I'd like to call this meeting of the St. Andrews Task Force to order. First thing that we have on the agenda this evening is reports. Jim.
Representative Bruce McDonald said that he wasn't going to be here for the meeting tonight. He's taken away from town. But the Community Hospital Work Group is going to have a report from Mr. Barry, who sat in on some of the meetings. Can you help us out a little bit?
Hi, thank you. We are, the focus group that we're dealing with is dealing with an economic model that will be competitive for the operation of St. Andrews. This is a focus group that's from the Bruce Group, the Tuesday morning working group, which is looking at community-owned and operated healthcare system. So we met on the focus group last week. Because of various trips that people have, we can't get together face-to-face this week, but through the magic of email, it's like we've never adjourned. We've received an initial draft from the consultants. Everybody responded to that, and we'll be getting a second draft. And that is going to be that document, which we hope is going to prove to be an acceptable solution to the St. Andrews issue. And we'll be meeting face-to-face with that group later this week.
Thank you. Thank you, Tom.
You can have a meeting next Tuesday morning?
Bruce was having, I thought he gave us that on Tuesday morning, and this one's canceled. But that's usually when they are, am I right?
Yeah.
Great. So the meeting with the consultants, a few key members, right?
Yes. That's a little narrower group.
Right. And the consultants, I guess, have put together a proposal of what they can do that they're going to deliver to that work group. And I think it's still in the very early stages. Bruce had said that they had asked them to rework some of the proposal, and I guess I'm going to go to that meeting and see what the town can do to help as well. And then I think the regular, does anybody remember what Bruce's regular meeting schedule is? Tuesday mornings?
Tuesday morning at 9 a.m.
Tuesday morning at 9 a.m. Thank you. Is Mr. Twaddle here tonight, or anybody from the data analysis work group? I knew that they come in earlier this week. There was a few of them working on data analysis, and I'm not sure the status of all the requests that they made to Lincoln County Healthcare. Is Stacy here? Do you know the status of any of the requests?
I do. We were supposed to meet tomorrow morning, but that has since been rescheduled to October 18th, I think. Peggy's out of town this week, so.
Do you know what time that meeting is?
I think it's in the morning sometime, but I don't remember the time, to be honest.
Over 18th.
18th is a Thursday.
Thursday. I might actually be able to do that one.
All my chicken scratches are still on the calendar.
Hey, Jim. John?
Yes.
Just looking at Mike Painter, I'm also part of that group. I'm on the periphery. We were trying to settle on the 18th, but it's been kind of tricky due to a variety of schedules. I'm not sure, just for the record, I'm not sure the 18th is actually going to happen. We've been trading emails amongst each other. But it's been tricky, and we're also trying to focus in on what all that meeting is going to be, frankly, be it the Navigate report or other topics, because there were requests for information that we've been dealing with. So it's really more up in the air than just going to be on the 18th at this point.
I got an email from Andrew this afternoon trying to schedule it for them, but it's not.
We should meet again before that time, so then we can update the group on when that next scheduled meeting will be.
Okay. Volunteer coordinator. I know Peggy's in the room.
Peggy's always in the room. She's here more than I am.
You all have your weekly updates. If you got them through your email, or I have hard copies tonight. I want to thank you for some incredible work, and if all of the volunteers would give their reports about their individual activities, we'd be here all night. So let me just give you some highlights. We have boxes in 16 different businesses that have accepted boxes, and Alice is writing thank you notes to individuals who have donated or sent us money. We have an incredible movement with the questions for the Booth Bay Region Ambulance Service. I would like to talk to anybody tonight after this meeting who would like to submit a question or talk about how that's being done. We have a couple of new things happening on your weekly update. If you want to come to office hours, Monday, Wednesdays, and Fridays, 2 to 4, on the front of your weekly update, it tells you what we're trying to do during those office hours, so you know when you come to volunteer what it is that you can do. If you want to just come and research, all of the stuff is here. All of the books have the names of the various work groups. They're as up to date as we can make them, and the weekly updates tell you the stuff that's in the books and where to find them. I'm going to make a plea with that for all of you who want to be involved with this to get smart, to spend some time on the Channel 7 blog. And John's promised me that when he runs this, he's going to put how you reach the blog on your computer. Access old meetings, because a lot of the questions that we're getting about the ambulance service have been addressed. And it would be good to see if you have any new questions. So what the volunteers are attempting to do is log the various tapes that you can find on Channel 7 so that you don't have to go through the entire tape to find out where your question is asked. And hopefully we'll get that information out. The same thing is true with the Booth Bay Register. If you go online, and John's promised he's going to put up what that link is, boothbayregister.com is pretty simple, but just in case, it will be there. They have an incredible listing of how we've gotten to where we are today. Sue takes great pains in making sure that all of the information is there, the questions that have been asked, how they have been answered. So as you're getting involved with us, get smart. Spend some time in getting smart. I know it can seem like it's a real bore, but when you come to these meetings and you are knowledgeable, a lot of the things that are happening makes more sense. So that's my plea for this week. And definitely the Booth Bay Region Ambulance Service, I'm still collecting those questions. My husband reminded me that in business school there are several things, there are steps in when groups come together, what happens. And the first thing that usually is people storm, and I think most of our storming is over. We're now no longer just wanting to vent our anger. But it goes storming, forming, norming, and performing. And we're in that space where we are stopping being angry and we are beginning to form. And if you come and volunteer, you'll see how that comes together because there's lots of good work going on out there. And I want to thank whoever is responsible for the great big sign at the Railway Village that matches our sign out here. Who's responsible for that? Anybody want to own up to it? Ruth is shaking her head no, but it was one of the requests, and all of a sudden I'm driving back from doing errands today, and there it was. So thank you, whomever. Again, I'll be here after the meeting if anybody wants to volunteer, and thank you all. If you have any questions about the update, or if you want to be on this list, it's mailed out either Sunday nights or Monday mornings before the meetings. You can see what we've got. I'm sure that somebody is going to talk about the money, and so we're happy to do that too.
Thank you, Peggy.
I see. I'm reminded by Patty's effort when I looked at the volunteer. Anything to comment on your effort with interviews?
Yes, I've started interviewing people, and I could really use some help recruiting interviewees. I've got people signed up in Booth Bay and in East Booth Bay particularly, and some seasonal folks that I'm trying to get through this week before they leave. But I don't really have a lot of people in Southport or in Edgecombe or in Booth Bay Harbor. And we're particularly looking for young families, because I seem to have lots of older people who are willing to talk about St. Andrews, but I'd like to also make sure we have young families represented. So if you have, if either you or somebody that you know has strong opinions and would like to be interviewed, please, I'll be here right after. Please just give me a name and ideally a phone number or some way that I can track them down. Thank you.
Patty, can you just reiterate what your effort is in case it's a Channel 7 viewer for the
Sure.
first time?
So what I'm doing is interviewing about 50 people on the peninsula in all of the communities, all age groups, to try to understand what they want in St. Andrews and also what kind of in general health and wellness services they feel we need on the peninsula.
Thank you.
Patty, say it's anonymous. Say it's
Oh, yes,
anonymous.
it is anonymous, right. So
Their names won't be used.
I will be summarizing and nobody will know who you are.
The ambulance service work group, do they meet today, Stacy?
No, we meet the 9th, I think, Tuesday.
Second Tuesday, okay. And it was a Tuesday as we approached April. So I don't think the Booth Bay Region Ambulance Service has anything new to update with. I know that they're still working on their budget process to try to figure out what the shortfall in monetary numbers is going to be. But I don't see anybody from the ambulance here tonight. But they're probably in the office working on their budget right now. But I put them on here in case they would be here. The Lincoln County Regional Planning Commission is planning on having their next meeting here at the Booth Bay Fire Department, the Booth Bay Firehouse. I think that is going to be on the 17th, but I have to check my schedule. I'll report that back at the next meeting when that actually is going to be. But one of the main topics that they're going to have is the economic impact study as they work on that. You know, it's going to take them a while to put together the economic impact study, and it may not be helpful in the beginning stages of figuring out what the impact to the community is going to be, but it might be helpful as we get closer to April. So I'm not sure it'll be a helpful tool, but it'll be a helpful study later. Financials and fundraising. This is actually getting fun to report on. At first it was a bear. So the first thing that I wanted to report is that I personally wrote back to the McAvoy Foundation, and I shared this to the task force members and the Booth Bay Board of Selectmen members. I think actually all the Board of Selectmen from the four towns, because it was kind of monumental. I think I attached everybody. But I wrote back to one of the trustees that we had heard from. I'm writing to report the results of the matching grant generously donated to the St. Andrews Task Force. Valerie Augustine, Booth Bay Harbor Select Woman, and Task Force member first discussed the generosity of the McAvoy Foundation as offered. The challenge grant was described as $5,000, the balance of $4,000 to be distributed after we raised the match in kind. I'm excited and proud to announce that the community responded eagerly. Since the announcement of the matching grant, the St. Andrews Project Fund has received $7,609 in donations in 1 week. I included receipts to verify. The McAvoy Foundation has once again led a community with vigor to obtain great achievements. The Booth Bay region is privileged to have such forward-thinking leaders, and the St. Andrews Task Force will close the day just above $15,000. That was September 28th. But I wanted to report that was exciting to see all of those funds come in after the McAvoy Foundation did their matching grant. So the financials as of today's date, at the close of business, the project fund is $19,764.35. And the applause is for everybody that's donated, because literally we have just received the money. It's all been donations except for the town of Edgecombe's $500 donation that they made via their contingency fund. Congratulations to the community for responding. The money will go to a good cause no matter what. Those are the reports.
Thank you. Any questions for Jim?
One from me.
All right. Old business. contact associations and BCA.
So I put onto the old business some of the follow-up items we had from the last meeting, and I know that various people are working on these, and I'm not the one working on them. So I figured as old business, and instead of reports, we could ask, has there been a reach out to the associations? I know the BCA hasn't been formally contacted yet. I'm sure they pay attention. Because some of the information, is that correct? Let's put the
Yeah, we've got
EdCo.
the information from Booth Bay and Booth Bay Harbor. We're still waiting for Southport. And Edgecombe, and I got a note from Stuart Smith saying that he would get me the subdivision information that I need. And we're getting a letter, Jenny's working on it, Val's working on it. So as soon as we get the letter, I can zip those out to all the associations that I have
Tomorrow.
addresses for
You can have
the
tomorrow.
BCA.
And just to
No
update
questions
our.
about that?
If anybody wants to read the letter, I have it up here, and it's been through most of us. So I think all the edits are in here, so just the final draft needs to get completed.
I can get it tomorrow, I really do.
Mhm.
And it might be good too to let everybody know just the names of the associations that it's going to. And we'll
Okay,
put,
you
and we'll
have
put
the
that in
list, Val's got the list, if Jenny,
they'll be in the fundraising, the names of the organizations will be in the fundraising book.
Martin lost? Yeah.
Okay.
Thanks, Pat.
Just to tell the task force members, at first I thought the information search was gonna be easy, like the assessor would just be able to pull up all the, it's not, it wasn't as easy as we thought. We kinda had to scrap for that information. But, we do that pretty well. I mean, in the front office, we have like 60 years of organizational history, so we're able to scrap pretty well. And I bring 2 years of that. 2.
Mental health services.
Mental health services, I'm gonna keep on old business until I get the appropriate time to ask those questions. I really felt that like the lady that was here at the last meeting brought a really good question about how mental health services are gonna be offered. And we haven't had the opportunity to ask any questions yet. So I'm gonna keep it on old business until we have the opportunity to ask questions. And because it's a service that I don't know anything about. Yes, ma'am.
I'm Tam Back, I'm the one that brought up that issue last week. And I did try to do some research on my own this week with hospitals in the area that provide services, but I pretty much get a stone wall with everyone that, yes, we have rooms, but we can't tell you anything. You know, and I did find out through someone today at St. Andrews who also is involved with Miles, who is giving me their updated information that St. Andrews room is used very infrequently, but this is also coming from somebody that runs Miles. So I'm not sure if we're getting accurate information on that or not. But another thing that concerns me is, as I talked about the week before, with the many transfers that a person will be going through, it's also that if you're in an emergency room, any emergency room, whether it's starting in St. Andrews or Miles or anywhere else, if you're consistently passed around for 48 hours and you don't receive a psych bed anywhere, you're automatically discharged by the state of Maine without any services. So it's real important to start with that one place where you can stay with, go on from there.
Yeah, I think you bring an interesting point, and I'm just not knowledgeable enough to ask appropriate questions yet, and we haven't in the last week been able to ask any appropriate questions to St. Andrews Hospital about how mental health services are offered and what kind of impact would a change in hospital. I don't even know what the right questions are.
Yeah, I just see this as one of these little nuggets that's coming out of this entire process, is that we can bring this to light and bring this to people's attention, and we can get some answers and some solutions, because clearly there are issues that need to be addressed, and I see a hand up in the back of the room.
So I'm a little confused on a couple things. One is, if you have questions about mental health services, what's offered today versus what's going to be offered, we're ready, willing, and able to converse about those. So I don't understand, do you want us to schedule a meeting with you, or?
No, that's why I'm saying it's on old business until we have addressed it.
So how might we go about addressing that? So
I
that
need
you
to
get-
find out what appropriate questions are first.
So can I just say that the mental health services that are offered today in this community will not change with the pending changes on April 1st. What happens today at St. Andrews is if you come into the emergency department, there are no available beds. We don't admit for those diagnoses at St. Andrews Hospital, so you get transferred. That's what happens. If similar situation happens after April 1st, and it is during the hours of operation, you will be seen and then appropriately transferred to the appropriate facility. If it's after hours, you would call 911. Often happens same way today. When you're talking about psychiatric beds in the state, there is a complete shortage of psychiatric beds in the state of Maine, and it is hard for placement. So, as I said, we're very happy to converse about what services do we currently offer. We offer all kinds in the outpatient setting. We're happy to sit down. You just need to, we'd be happy to schedule a meeting, or you guys could schedule a meeting.
And I think where I was going is I don't have any questions that what's currently happening is going to continue to happen. What I'm seeing this is an opportunity to maybe shed some light where the light is not shown so that we can address the issue of why is there a shortage of beds for
Or
these
enhance the
people.
service.
I'm sorry?
Or enhance.
Yes, that, you know, maybe we can help find a way to make this a better situation, so.
Excuse me, even looking at, they're closing the bed units there at St. Andrews. I mean, I know you're looking to keep that open, but maybe if those beds do end up being closed, opening a small psych unit or something there. In still keeping the hospital going, but doing something with those bed areas that you have.
Amen.
Sandra?
When you have somebody come into the emergency room for mental health and there are no beds, is there any hookup for follow-up? You know, refer them to a therapist or anything? Because I worked in an emergency room in Massachusetts for years, and my job was to evaluate people. And if there were no beds, my job also was to hook these people up with an outside therapist.
Right. So St. Andrews Hospital presently has Sweetser for their crisis intervention. So Sweetser comes to the emergency department most of the time. They are the people, they have case management services, nurses, physicians. They are the people who work on current placement. If the patient
If they have
requires,
no insurance, then what?
same thing.
Same
They
thing.
come regardless
And
of
you
your.
hook them up with.
Yes, depending on what the diagnosis is, whatever treatment needs to happen. So Sweetser is our crisis intervention contract. They'll continue to be that contract, and they are the same. They are the crisis management people for all of Lincoln County, and the state divides you up into regions, and so
When
we
you
have.
say state, who does that? I mean,
I believe
who's
it's
the
the
people?
Department of Health.
Okay, do you have people that
Services.
come out from the state to St. Andrews to do this, or do you
No, it's an,
contact them?
no, so the emergency department will call. So if someone shows up in the emergency department, they determine they need crisis intervention, Sweetser is called, and they come into the emergency department. And they handle all applicable referrals, levels of service, et cetera.
Will that happen after April 1st?
It'll continue to happen.
Just so it's from
April
8 to
1st.
6?
Yes.
And as far as the bed is concerned, for somebody that is coming in, would that could be decided clearly by Sweetser? On where they could go?
Right, you have to have licensed psychiatric beds, so presently St. Andrews. does
No,
not
I
have
understand St. Andrews
Yes.
doesn't. I'm saying, the Sweetser,
They help find bed placement all over the state.
there you go, that's
All over
good.
the state.
Yeah.
But it's probable if there's
Right.
emergent mental health care needed, that the ambulance service is gonna have to bring somebody there.
What they will do is bring, so if you get picked up by an ambulance, they'll bring them after April 1st to Miles. Same thing, crisis comes to the Miles Emergency Department, physician assesses them, determines they need crisis. Sweetser comes and they work with the physicians and nurses to provide appropriate placement for the patient. But she's right, sometimes it takes a long time, just because of the shortage of
Are there
beds.
psych days at Miles?
No.
Question, in the Navigant study, I believe that it shows that there's a shortage of 3.3 psychiatrists for this population.
Right.
Whose responsibility is it to recruit psychiatrists for
Right
the
now,
population?
we are working with an entity called Maine Mental Health Partners. They have responsibility presently, they've just taken over, it's called Midcoast Mental Health Center out of the Penn Bay area. So the Penn Bay area is now the mental health provider for those of us at Miles and those of us at St. Andrews. They have recently placed one psychiatrist 3 days a week in Damascata, and we're working with them to try to find nurse practitioners to come to the area. Licensed clinical social workers have been placed in all of the primary care offices. So mental health is an area that we're looking to expand upon, but there is an unbelievable shortage of psychiatrists nationwide.
Right.
And most social work, most
No, but I mean, there
psychiatrists.
must also be a shortage of money.
We have a contract with I'll get these names messed up because they're all kinds of, Midcoast Mental Health Center out of Rockport to provide for, what we're asking for is 2 adult psychiatrists, 1 child, I might have some of those numbers wrong, 4 licensed clinical social workers.
Would an ambulance have, if they had an emergent mental health illness, have to take somebody to Rockport?
No. Well, possibly.
Potentially, sure.
Possibly, yes. So what happens today is Sweetser will come to find beds. So Rockland has beds. They have a small inpatient unit. If they have bed availability, then transfers are made to Penn Bay, they're made to Bangor, they're made to Portland. There's an extensive shortage of beds as well in the state, so.
And that's why I stated that I didn't have an appropriate question yet, because I don't understand how mental health transfers are done. But the concern that I have to educate myself on is how long would an ambulance crew be off the peninsula transporting somebody to a mental health facility? Because that's
We'll
what
do
I'm
it today,
concerned.
so, I
Do
mean,
you
it
have a
happens
clinical
today.
person that
Sorry?
accompanies, do you have a clinical person who accompanies the ambulance service when you transport?
I'm not sure, honestly.
No, not usually.
You'd have to ask the ambulance attendant.
When I've been transferred, I can only speak for me personally, and usually it's just myself and the 2 ambulance attendants, one to drive, one to be in the back with you. I can't say that that occurs in all instances, but it has with myself.
Ma'am, I don't want to put you on the spot, but you said you go to the emergency room now sometimes, and then you wait there until they were to place you in.
I've been in the emergency room overnight a couple of times, waiting to be placed.
Yeah, so the question that comes to me is I have to educate myself on if the ambulance service is now responding, how long are they tied up?
It could be as long as going to Lewiston and doing a transfer with somebody there. It can be, it's all over the state now that they're trying to get beds. So they could be going up to Holden if there's a hospital up there or wherever the furthest hospital is. If they have an opening, that's where you go.
It may be a smaller percentage of cases, but it sounds like something that will tie up resources more.
Yes.
So
What about respite facilities? You don't-
There
have any-
are 3 in the state of Maine, if I am correct. 3 what they called is stabilization units. There's one in Rockland, there's one in Brunswick, and I believe there's one over in Lewiston. And those are only at most 4-bed units.
And just like to point out that one of the things that can hold up a transfer is that psychiatric facilities do not accept patients unless they're medically stable. So if your psychiatric problem is a substance abuse problem, the person has to be cold sober before they will accept them. Blood alcohol down to under drunken levels. And if there is a simultaneous medical problem, as in, say, heart disease or diabetes that's out of control, in addition to the psychiatric problem, it can be a real difficult thing to place patients.
How do you
And this
do-
would also necessitate possibly a higher level of ambulance transport if you have someone who's, as I said, out of control diabetes, for example, but needs to go to a psychiatric facility or needs to go from the urgent care center to Miles because it's 6 p.m. And if you need to transfer somebody to finish sobering up, for example, before he can be placed in the psych bed.
What about involuntary commitments and things like that? How does St. Andrews handle that?
That would come after sweets are, I believe.
Yeah.
It still goes
Yeah.
through Sweetser.
Do they have a psychiatrist on call to do that?
Helen?
Is that a-
Most of the time, from what I remember, that, and I've been on a lot of those calls in the past, and we were sent with appropriate people in the back. Sometimes we had a nurse with us, depending on the situation. And it can get hairy at times, but yet, if you sit there and listen to most of them and talk to them, you try to keep them as calm as you can, you know, and things like that. And usually that makes the trip less stressful on them, you know, because they're still people. And they need to be taken care of that way. They need to have that stress removed. They need to do this. And, but they do send the appropriate people. If they think a medic is needed, then that medic would be in the back with that person and there'd be a driver. But see, with the drivers now, you can stop real quick if you have to, and you can get in the back. You can haul out. There's any amount of numbers. And when you pull into a hospital, you can just say, you need extra hands. They're there. At least they aren't being men, okay? And so as long as you're taking care of your patient, that does, like I say, makes the trip more bearable for them. And, but it does take time, and that's the truth, it does take time, depending on the individual, depending on what the real issue is, you know. There's different things. We had one long time ago who actually chewed up an ambulance stretcher pad. She actually chewed it up, you know. And that was a long time ago. But things like that, you know, if somebody gets out of control, your medic is usually the one that can get it taken care of for us. Being a plain EMT, you can't do that, but you can if you're a medic.
This is clearly an issue that's gonna warrant a lot of education on all our parts. And again, this could be a real bonus, no matter the outcome here, that we could maybe bring this to a better light.
Agreed.
And to say for St. Andrews right now, somebody that's gone through the facility that they have set up, the room that they have set up, it's very well designed for somebody who is in the mental health state that needs the security and stuff like that. They designed the room specifically for the safety of that individual. And having been in other hospital units, it's not always designed for that. So that's another thing that benefits St. Andrews is that they have rooms specifically designed for mental health patients.
Thank you.
I plan on sitting down with Scott from the ambulance service and trying to come up with some appropriate questions as it pertains to mental health, because the alarming part of that is we've been talking about routine functions in the ambulance service. Well, what about non-routine functions like mental health calls, which I know can tie up resources longer than we anticipate.
Good issue.
Yes. All right. Second interview?
The second interview, I don't think we've gotten a lot of work done on producing the second interview, and most of it I think has to do with the fact that we haven't discussed amongst the task force what we want to try to develop. And I know we're a little short-handed last meeting, so I wanted to put that under old business. What do we want to try to develop with the second interview? We're talking about a follow-up to the Dr. Foray interview.
Do you mean with Dr. Foray?
I mean, that's what I don't know, is are we including Dr. Foray, are we including some rebuttal interviews as well? Are we putting them all on the same platform? What kind of product are we trying to develop on the second interview? Because I just need a little more clarity and then we can start working on it.
Well, I think it would not be a bad thing to bring in a different point of view, you know? We've heard Dr. Foray, you know, expound very eloquently, and I think it would be a reasonable thing to bring another voice to the public.
Do we have any candidates for that kind of?
Well, I think we might.
I think we can find them. I kind of have a couple of inclinations of where we start, but I wanted to make sure that I was working. I knew
And that's my
products
thought.
we wanted to get first. If we want to get a one-on-one interview with somebody that provides an emergency service that is completely off the map and not involved in Lincoln County Healthcare or the Booth Bay area, we can obtain that. But I want to know that that's the product that we wanted to obtain.
That's a question.
Yes.
I would like to recommend that, along the lines Jim is suggesting, that we have somebody talk to us who could talk about the use of telemedicine in the emergency room, because my understanding is that that's practiced pretty widely, and we could contract with somebody, whether it's Mass General or some independent organization, to basically be right there with our physicians in the emergency room.
I think that I was looking through something, many things, yesterday, and I think it's about $45,000 to get that system.
Not necessarily. So that's what I think we need more education on.
So,
I mean, that's one of the figures that was
Yeah.
there, but.
you may not want to talk to Lincoln County Healthcare about this, but Lincoln County Healthcare does telemedicine out of the emergency departments and at both Miles and St. Andrews also through the contract with the mental health partners. So we offer it to you for information, but.
I'd like to mention that she hasn't been interviewed for Channel 7, but Dr. Judy Stone has published 2 blog entries in the Scientific American blog, which anybody can get online. And they are quite illuminating. And I suggest that everybody read those, and she'd be an excellent candidate as somebody who understands what's going on.
There are also hard copies in the files.
Yes. Yeah, I think we've sent those to Mr. Pankowitz as well, so they're probably in the Google groups as well. And Dr. Stone has already volunteered her time if that's who you want to work with. So let me come up with a couple of names and then bring them back to that.
Yeah, if I remember right, Dr. Stone told me she'd only be here until I think November.
Oh, so we would have to move quickly. Okay. I think Dr. Stone's only hang-up was that she's really good at. She said she was really good at researching the information, but the spontaneous question, she said that's not her forte. And as some people are good with the spontaneous question and the interview kind of format, and I think we'd respect the fact that if she doesn't want to do that format, because we'll talk.
Did you excerpt the portion of the meeting at the school that you spoke at?
Yeah, she did pretty good in that.
You did a very nice job on that, and if you didn't have to wade through other things, and you could just find it right away.
Yeah.
It's
valuable.
Dr. Oliphant, it's actually on the Channel 7 blog, because John has got everything from day one right through
Well, yeah,
tonight's
but
meeting.
is it easy to access, or is it just part of the meeting?
John, you broke that initial four-town meeting up into 4 pieces,
The initial
right?
big town meeting was broken down.
Yeah, so it should be in the
She
first part.
was the first one to speak,
Yes.
so it's the first opening
Okay.
statements or whatever.
So that if somebody's going there, they can see that, let's look at Judy Stone. Does it say Judy Stone if they weren't there, they didn't know she spoke first? That's what I'm talking about. To
I think we
More
need to do it
clearly,
someday.
shall we say.
I don't think we want to rely on that. It's a good resource, and people can look at it, but I think we need to do another interview.
If, as long as it sounds like a plausible product, I mean, the Dr. Foray interviews out there, we can have Dr. Stone analyze the questions over there and give us rebuttal to the interview. It's not as spontaneous as what Dr. Foray had to do, but I think the spontaneity of the interview with Dr. Foray was that it was a Lincoln County healthcare respondent, and we didn't want to serve them with the questions that they could essentially have
I think
an answer.
if Dr. Stone was unavailable, I think we could come up with another
I know.
person.
I just want to make sure I understand what the task force wants for a product.
Well,
I think I got it.
Is Dr. Ford is he on the board of?
Yes.
Yeah.
Yeah.
So, I mean, he had years of
Oh, yeah,
being
this
in
is-
this issue to prepare, so I think it's fair for somebody else who's going to be interviewing to prepare some answers.
I agree. I just want to make sure that's what the task force wants.
Couldn't you interview Dr. Stone and add it to anything else you want for a final product?
Sure.
Yes. I think we could do an interview with Dr. Stone, and then we could probably find somebody that does
that's what I meant.
emergency room
And put it all
medicine from
together.
afar and
Yeah,
have
that
three
would be good.
perspectives.
Yeah.
I don't
The more information, the better.
Yes.
We have a lead on another hospital group that we may be able to take and interview their emergency, I always say emergency room, but I don't think that's technically correct anymore.
Emergency department.
Department director. I watched a lot of ER in the 90s.
All right.
I will work on that.
Okay.
I think that probably is one of our next primary steps.
You weren't planning to have George Clooney, were you?
If he'll do the interview, I will conduct it. Does anybody have those connections?
I got it with George Clooney, you won't get a chance to do the interview. I think Sue's gonna be all over that.
All right, new business. Polling questions for November 6th.
At the end of our meeting last week, somebody brought up a really good point, that we're about to have a cross-section of people walk through the town office, in which we can ask them any question that we want. A pretty good cross-section of all 4 towns, considering November 6th is presidential election. I think if you can't miss out on that opportunity to ask whatever you want to ask.
I happen to have a connection with the town clerk in Southport, and I spoke with her, and she said that it's way too late to get a question on a ballot. That is no hope, but what we could easily do is do a petition where you would have somebody, they would have to be dealing with the people after they've gone through the voting process. They can't be out soliciting, but you can put up a small sign. You can't have bells and whistles and a table full of paraphernalia, but we can certainly do that in all the polling places. There's no reason, we've got to make that happen. We're foolish if we don't.
It could be a small survey as well. I mean, so a small survey or a petition. I don't know what a petition question would be at this point, but a small survey, I think we can easily round up 10 or a dozen questions that we want to know the answers to from cross sections of
Right.
the 4 towns.
I've started working on some stuff, but I haven't got anything I want to put out in the public. But yeah, the bottom line is we can do this.
Right.
So we've just got to pull it together and have it ready and have people ready to man it in the polls. So that will be some volunteer work that will need to be done on the day of election day.
Right. So I guess the follow-up question is, we need to figure out what we want for those. Are we saying the survey is what we want to do? A small survey, try to get some statistically relevant answers to questions from the cross section of the community that's going to come out to the polls. Is that what?
Well,
In addition to?
What's that?
In addition to the petition?
Are we? I mean, that's what I'm trying to find out. Are we talking petition? Are we talking survey? Are we talking both?
Both. It can't hurt.
I would think if we can put it together, we do both.
You know, a volunteer survey is not incredibly difficult. I just need to know what are the.
I'm not sure if we can do a survey inside the polling area, we may have to do that outside.
Right.
We can do a survey inside the polling area. I mean, we can do a petition inside this polling area. I don't know if we can do a survey.
Yeah, I don't know.
Because that would be disruptive. I don't know if we could pull that off, but we could do it outside, I think.
Can you do a donation box?
Not in the polling area, no.
Come on, the finance committee, come on.
I'd like just to comment that this group has been meeting. We've got representatives of each of the boards of selectmen on the, essentially the committee that's been formed as a result of the meeting that was held, in which several hundred people expressed, I think, clear, almost unanimous desire to see something done to maintain the hospital. And yet, there are a lot of people on the peninsula that have not been heard from. And it seems to me that it's very important to get a petition established, get lots of signatures on it, not just on that day, but on every other possible day, and in order to make clear where we stand. For all we know, it's only us. And the fact is that we know that's not true. My own experience has been that almost universally people want to see the hospital kept open. And but it would be very useful, it seems to me, to have a count, a head count, in the form of a petition. And so the wording on the petition has to be carefully done. It's a task to get done, and I certainly would urge that it get done before November 6th. But
I'm kind
I
of
think
thinking like having it ready for next meeting.
That needn't be the end of it.
Yeah, I think we need to wordsmith something so that we have enough time to get that to our, we want to give our town clerks the proper notice, like anybody that would have a petition at the polls. And I know they're already being solicited for petition space. And we don't want to suggest that we get an unfair advantage for that space. So we need to start wordsmithing that question. As I can tell you, I honestly don't even know what the question would be. It's going to take some time. We'll probably need some citizen input too.
If you think a petition, and Smith, maybe, I think what you said is making me think that this is what you think, that a petition would be more appropriate at the polls.
No
and we
question.
can do the petition not just at the polls, but outside of that as well. I think a survey would also give us some valuable information as to what constituents and people in this area are thinking and wanting.
Well,
So we could do like an online survey.
we could do an online survey, we could print up a survey in the register that people could cut out and either mail to us or drop off. I think that's a great idea, and I love the online concept of it. But I definitely know that as far as trying to do a survey in a polling area, that's just not gonna work.
But if you use like a tool like SurveyMonkey, you could essentially hand out the link to people that are.
Absolutely.
As you ask them to sign the petition, here's a link, please fill out a survey, this information will be helpful to the task force.
You can enter in paper ones as well.
Yeah.
Right.
Helen?
I spoke to Debbie Mellon after I left here the other night, and she was at Hannaford at the same time I was. And we have a table. I spoke to Peggy over here about it. We will be having a table at the school for the Senior Appreciation Day. And Deb said that is one place where we will get a whole lot of people, it'll be anyone from 50 up or whatever. And like this year, I believe AARP and your Social Security can't be there because they can't work on Saturday. So they can't be there this year. But she's told me she had 30 tables, which where one, you don't have to pay for it or anything. And because they got tables and chairs and things at the school. And I said, Deb, what can we possibly do to, what could we do for these people? And she
suggested that we maybe make up some little cards, and if you would like to donate, this is how you do it. If you would, even watch the television, we're trying to keep the hospital open, just various little things. And maybe have, maybe we'll have a small raffle beside it. But she said we could do that. So that's up to everybody if you thought that was all right to do. Because we'll have Lincoln County, there'll be Lincoln County there, there'll be something doing on scams and some other things.
Not that we're insinuating that there's any scams going on.
When is it?
It's gonna be the 28th, I think, is it? October. Okay, October 27th. It's on a Saturday, 10 to 2, at the elementary school. And a complimentary luncheon is prepared for the Triad. And this is through Triad. And I've been involved with it before, so, and it is a good program. But it's called Elder Appreciation.
Helen, I think that's a great idea, and similarly in this volunteer update, it mentions that Senior Appreciation Day and also the early bird sale. I know sometimes you can contact a downtown storefront and they'll let you set up a table in front of their store.
Thank you.
To have a table like that. So maybe the fundraising committee can put together some kind of a table presentation that we would put out there.
Maybe.
Sure we can.
June?
On your petition, just kind of think about, would you like to have each town the name, like have the same petition, but leave the town of blank residents so that you could fill in like the town.
Oh, yeah. Oh, absolutely.
Each town has a
Oh,
separate list
absolutely.
of names.
Yeah. Certainly the ones we do on election day will absolutely be that way, no question.
Well, if you're going to spread them around,
Well,
leave 4 at each spot.
Yeah, right.
Yes.
On the petition wording, I would recommend that you include the term critical access
oh yeah.
hospital, because I think basically what we need to ask people is, are we willing to lose our certification as a critical access hospital? And that's what's going to happen. And Peggy Pinkham had very clear.
Peggy?
And if we're going to do this, I want to know who's going to be the manning all of these 4 towns so come and let me know that you're willing to work on election day and which town you want to work in.
And if you already work as an election clerk, we don't want you to volunteer again. We have a hard time finding election clerks as it is. So can we do this digitally? Start wordsmithing a petition question, and I think it needs to be precise. I think you want a very precise question, and we'll enjoy the community's help in trying to make this question. If you have ideas, feel free to outpour, and Peggy will funnel them appropriately, like she does with everything. So yeah, help us to design this petition question. We'll come with some examples at the next meeting and toss them around. And then, if you guys don't mind, I'll work on some survey type questions. I think a survey will be easier for me to draft than the petition. One question.
Yeah, I've been playing around with it, and you're right. It's hard to focus it into one simple question.
Right.
Without having it be a paragraph long.
So we have 3 separate things. We have the possibility of an online survey that could also be reprinted in the newspaper or handed out if you wanted to do it by hand. We have the petition, which we could do at election day. And then we have the possibility of doing some booths at Senior Day and at the Early Bird Shopping Day downtown in Boothbay Harbor. And at those booths, we could certainly have the petition there as well, and the survey, and the donation box.
This is going to be important to try to find people that can help with these items. I mean, putting together the survey and the petition wording is going to be challenging enough, but to have somebody be there to deliver the petition, I mean, polls open 8 to 8. That's a long day. I can already see finding 2-hour intervals or somebody to stand there is going to be difficult. So think about that, and we'll try to, if you're interested in helping in that sort of way, get your thoughts to Peggy. Peggy will try to help us figure out if we're going to have enough people to even deliver this.
And the bottom line, folks, is this, is that, you know, you can always just leave the petition line on a table, but that's not making it happen. You need to have a face attached with it. You need to have somebody there who can answer simple questions, and so it's going to take commitment from people that are available on that day.
You also have to be careful that when you are establishing a petition procedure, that it's not possible for one person to sign 3 different petitions, so that your numbers are credible at the end and that it will withstand scrutiny. Because you can get in a lot of trouble. It can just be thrown out, and you will have wasted a lot of time.
Right. And we would probably knock down the work that the clerks do with having volunteers go through the petitions to make sure that we don't have double signatures. But that's a bear too, so just keep in mind. All the volunteers that have come out have been great. And I'm not trying to say we won't come up with volunteers. But be cognizant that this is a workload right now.
You're gonna need pad tables.
We what?
We usually provide those for.
Oh,
we usually provide those for people that have
Yeah.
space here.
yeah, same thing. We'll have that all set up. It's not a problem.
But sometimes we have to go steal the fire departments if we get 3 or 4 different.
All right. Recap the next meeting.
Well, the survey, which I think we want in a format that we can do both in paper and online. Start wordsmithing the petition language. Start soliciting volunteers for these and the booths for Senior Day. Need to come up with some plausible questions to propose to the ambulance service in Lincoln County Healthcare regarding mental health services, and then start working on the second interview. Those are the action items that I have.
Anything else? Public comments. Mike?
I'd like to make two points. One that has been made in the past, hasn't been made in a long time, and I think we have to make it again. And acknowledge the workers at St. Andrews right now. The workers that are there, we still love you. For those watching at home, from the grounds workers to the custodial staff, to the administrative staff, to the medical staff, every time every one of us walks in that hospital from now on, make sure you acknowledge every single worker and say, we love you, we want you here beyond April 1st.
Amen.
We love you. Make sure we all My next point is this. St. Andrews is due to close in 182 days. 182 days from today, St. Andrews will cease to exist under current plans. That's not a lot of time. It's not a lot of time to travel down all the roads. Perhaps it's enough time to close it down and set up a dock in a box as is being proposed. It is enough time to do that. Plans are in the works to do that. That can happen if we all sit back. What I'm saying to folks in this room is to keep up the spirit. I'm saying to folks at home, please join us. You may see the same faces. These aren't the only folks working on this. If indeed you have something to offer, if you're a citizen, if you're a medical care worker, if you're a past board member, if you're a present board member, Present board members have been decidedly silent on this issue. We would like to hear from you. We absolutely would like to hear from you. You can talk to me, you can talk to anyone else. You can talk to anyone else confidentially. You can talk to us individually. You can talk to us in public. We need to hear from you. We're still sorting out what happened and where we're going. We need that information. So I'm soliciting information from the public at this point. Absolutely, we need information. We have 182 days. Next week, we'll have 7 days less. The clock is ticking. If we sit back and lose our enthusiasm, that clock will tick right down to day one, and we'll wonder what happened. See you next week.
Amen, brother.
Amen.
Who wants to top that?
All right, if we don't have any other public comment, I'll entertain a motion to adjourn.
I move we adjourn.
Oh, before I second that, just in that kind of same spirit, I do want to thank all of you for coming every week and helping out and doing all of this work. And I do encourage everybody else who's out there to please come and join us. As I've said all along, whatever your opinion is, we want to hear it. And we want to know what your questions are, and we want to know what your thoughts are, and we would love to see you in this room. So.
Our legal counsel has told us that one of the strongest asset that we have is that people are in support of this effort. So I know a lot of people watch us from home on Channel 7, but the outpouring of people that come to these meetings, and I know are sometimes hearing the same information, continue to come, continue to express interest, continue to volunteer. It's the largest asset that we have in this effort.
Are you able to tell us anything about legal counsel?
I can't yet. I cannot yet, but we are actively working.
There you go.
And I wish I could report, but as soon as we do have something concrete, that's when we're going to be looking for all the people that have been coming out and paying attention to support that effort.
Yes, we know that.
And I will second the motion.
I'd like to make one additional comment. The question of the existing Board of Trustees was raised. This is in the category of unsubstantiated rumor, but I heard from somebody who knows one of the trustees. They had a meeting last week, and it was described as very boring. All they had to do was, by rote, just elect some new trustees. In short, they have no idea or they're not paying attention to the fact that their alleged customers are extremely unhappy with what they're doing.
Must be one blind group.
Stacy?
So I actually was at that board meeting, and I can tell you that that wouldn't be my assessment of that board meeting. I'm not really sure why you would bring this up during the course of this conversation. Lincoln County Healthcare is here. I'm part of Lincoln County Healthcare. I'm a resident of Booth Bay Harbor. I would like to see, I enjoy the questions. I want people, you say you're interested in the information, then ask us questions. Ask us to come to meetings. Ask us to help educate you. That's what we are interested in doing. Sitting around talking about what you perceive.
No, actually, we're trying to educate you.
Well, that's fine.
Correct. That's correct.
We asked. How did we do that as well?
And you told us you couldn't answer this, that.
We-
There were questions asked.
To whatever extent you would like to ask us questions, we're happy to answer. I will not have all the answers. I will not have them, but I'm happy to get the answers for you.
We've asked almost every meeting how each member voted, and we have never once gotten an answer.
I think that one of the things that we said was, we are happy to answer questions with respect to How did we get to this place? What information did we look at? Why are we making these recommendations?
Why wouldn't you say how everyone voted?
Because it's not my place to say
Well,
that.
you were saying you're answering questions.
It's not my place, but if you would like to get together with someone who could answer that question for you, that would be terrific. I don't know whether it would be our CEO, whether it would be the board leadership, I'm not sure. But from my perspective, in order for us to move this process forward, then you need to be informed. I think having a
Can you go
interview
back
with
in minutes?
somebody, I'd be happy to.
And give us an answer next week?
Sure, but it's entirely possible that some of the questions that you're going to ask, you're not gonna like the answer to. But that doesn't mean that you haven't had the opportunity to
But
ask.
she just asked you a question, could we have next
Yes,
meeting?
I would certainly. So last week you were talking about community needs assessment. And I looked at, is it Patty? Is it Patty? And I said, you know what, I think we have one of those. You don't have to go out and do one, I think we have one. Let me see if I can find the link for that. So, my point is, that was anecdotal, not true, and we want to be engaged in a positive process here. Positive in a manner, in you asking questions. I might not have the answers for them, but I'm happy to go back, but not anecdotal and not untrue.
Stacy, there was board changeover at the?
Board changeover happens in October.
So
Are we in October?
Yes.
Yes,
We are.
so in October.
So-
So it happens, it doesn't happen until, we recognize 2 board leaders who were retiring, but the changeover doesn't happen until October, so I think it's this month's board meeting.
But you've elected some new people.
No, they did not do that
No,
at
did
the
not
last
elect.
board meeting,
Okay.
no.
I'm just asking.
Well, I'm trying to answer, you know, sometimes it gets a little tough up here to answer these.
Would they be willing to elect somebody from this group to the board?
I don't know, Tom.
No.
I don't know.
That would maybe be a liaison.
I don't know. I can tell you the process by which they go through. It's no different than what the YMCA board goes through. It's no different than what the land trust goes through. It's the same process that most not-for-profit organizations go through. There is a board of directors. So I'm on the board at the YMCA, and what happens is they have a group. It's called the Board Governance Committee. They get together and they figure out what kind of talent do you need on your board. It might be legal, it might be accounting, it might be community representation, it might be the age, it could be any host of things. And then that committee, did you guys have something?
I'm
you
sorry.
wanted to
No.
share?
Yeah, I just thought
Do you want me
public.
to stop?
No, I thought public relations would be a nice addition.
It could be. I was giving.
Ethan?
Oh, I was just wondering, in the spirit of cooperation and positivity and candor, if the board would be amenable to providing its minutes to this group of people.
No, so I'm pretty sure I answered the question to the best of my ability last meeting, maybe 2 meetings.
I didn't attend, I apologize.
So the deal is that we are not going to release bylaws, votes, minutes, things of that nature. Should the task force, Smith, did you have a question about that?
No, I'm having a conversation, is, or you can talk, and it's a side conversation.
So we didn't.
But thanks for asking.
We didn't release that, and we're not prepared to do that.
And you're
Legal
not-
counsel can ask our legal counsel, and I'm sure you guys can have that conversation. So,
Mike?
If I can add to that, I mean, we are talking about cooperation. And here we are, talking about our hospital that we treated as a community hospital up until now, up until this past August. We treated it as a community hospital with Lincoln County Health Partners. Partners is their name. We treated it as such. Now we ask for documentation, and we're told to go through legal counsel. Now we're told, after we've raised a $500,000 endowment, we're told to support that hospital. That endowment is a $500,000. We have no idea where that money's going. It's going to support an empty building with a dock in a box. We're told now, we have to raise $20,000 to spend on a lawyer to ask our hospital for documentation that we always thought was public, that we have a right to see. According to the state, we don't. It's not on file at the Secretary of State. If you go to the Secretary of State's office, that is not available to the public. That's just main law. That doesn't have anything to do with Stacy Miller or the hospital. But now, we are spending $20,000 of our money on a lawyer. We have to go to a lawyer to communicate with our own hospital, the hospital that we're
It's
supposed to
sad.
be here and loving.
It's sad, isn't it?
We have a motion and a second to
We already
adjourn.
did that.
We're waiting for you to do this, okay?